And I don't know 100%, so don't quote me on this. I don't know if the antibodies like encase the sperm and that causes the clumping, or they just kind of get all bound up in the antibodies so that it looks like clumping. I'm not really sure. But if the agglutination might be indicating the presence of anti-sperm antibodies. And this may be an immunological reason for infertility, because it basically won't let the sperm survive and it won't let them swim properly. That's one of the biggest things with the agglutination, is it's likely making a huge impact with motility. And if you think about, like, this is how I kind of picture it, is in like a lazy river, right? And everyone's sitting in their little inner tubes in the lazy river. It's just such a funny thing to bring up, because it was just like last week or the week before, my 7-year-old was actually asking me what a lazy river was. And I was like, where did you even hear about this? I'm like, but they're awesome. Let me tell you about the joys of a lazy river, son. But picture a lazy river with all these inner tubes. And for a brief moment in time, a bunch of inner tubes kind of like get connected, and then they come behind, more come behind, and they connect and connect and connect. And you basically have this big like section where no one can get through. That's kind of like what agglutination does. So even if there's other sperm that aren't in the clump that can swim quite well, if they can't navigate and get around because there's all these blockades through it, it's not going to be conducive to an optimized motility situation. So all that to say, if you are someone who has had scrotal surgery in the past, there's a chance that that leads to a higher risk factor of agglutination. That is something we cannot change. How we would approach that is looking at other sperm health parameters, making sure volume was good so that there's enough like thinned product in the semen to actually allow that clumping to maybe be a little bit less than if it was lower volume, because higher concentrations likely higher degree of clumping. And we would want to talk about, does doing IUI with a sperm wash make more sense for you given what we know? Because it would actually help remove that poor sperm, that clumped up sperm.